This man is Dr. David Szpilman out of Rio de Janeiro, Brazil. In 1997, he published findings from his database of patients treated by the local lifeguards. In all, over 41,000 patients were included in the database, 2,300 of which required care. Of these, 89% lived and 11% died. From this database, he took the initial physical exam findings, including vital signs, lung exam, and foam in the airway, and correlated these with outcome, primarily mortality. The result of which is known as the Szpilman Classification of drowning, and includes 6 grades. Grade 1 is a mild disease and represents those patients who are saved early in the drowning process. These patients are found to have a normal exam and are behaving normally. Based on the study findings, these patients have a 0% mortality and may be released on scene with education. Grades 2 and 3 represent moderate disease and indicate a more pronounced lack of oxygenation and possible lung injury in the patient. These patients may have foam in their airways, abnormal breathing, and abnormal behavior due to a lack of oxygen. These grades represent a higher risk population, with mortality up to 5%. They require rapid oxygenation and transport to a hospital. Grades 4, 5, and 6 represent severe disease and indicate a life-threatening lack of oxygen. On exam, these patients are found to have low blood pressure, may not be breathing, and may not have a pulse, all signs of severe hypoxic injury. Mortality in this group is greatly increased, up to 93% in those with cardiac arrest. Treatment includes oxygenation, CPR is needed, and transport to a hospital.